longer the trach stays in without being changed, the greater the chance it is of adhering to the skin of the throat. Obviously, not a good situation to be in. If the patient's trach is cuffed, like most ALS patients are, it is important to not overinflate it. This can cause the windpipe to stretch out in the places where it touches the trachea. Abscesses can also form where the cuff touches the windpipe if it stays there too long. These are some other reasons why the trach should be changed. Ideally, the trach should be exchanged with trachs of different lengths so the cuff will touch different places of the trachea, hopefully preventing these complications. Good respiratory therapy habits are key to keeping the lungs healthy. Regular use of the chest percussion vest shakes the mucus in the lungs loose, helping to prevent fluid buildup. I think the cough assist is the most important machine a vented patient can have. When using it, not only does it clear the lungs of secretions, but it also forces air into them. This action hyperinflates the lungs and will help them to remain pliable. I prefer to use the cough assist over suction because it is less traumatic to the delicate nature of the lungs. With suction there is always a chance of nicking a blood vessel in the lungs. I also use my cough assist for emergency ventilation. When my vent or trach isn't responding the way it should, my caregiver pops it on until the problem is solved. The cough assist is also good for the shortness of breath I experience when I watch the Razorbacks play football. Take deep breaths, Kip. Relax, basketball season is just around the corner. Living with a trach and vent means when you go places you must be prepared for the worst. I never leave home without the cough assist, suction, a battery backup, and a battery backup for the battery backup. An ambu bag goes everywhere I go. Expect the worst, hope for the best. Here are some things to remember when you encounter a person with ALS. I despise people who assume that just because you're in a wheelchair you are deaf, dumb, and blind. These are the people who bend over until their face is in front of yours, then they proceed to yell out every word slowly while they over-enunciate every syllable as they shower you with spit after every consonant is pronounced. OMG, WTH, get this moron out of my face. I can hear perfectly, and if anybody is the idiot in this conversation, believe me, it's this yahoo right in front of me. No, I'm not paying attention to you. I'm thinking of creative and exciting ways to run you over in my wheelchair. When a patient communicates through a speech generation device, ask before you start reading over their shoulder and try to guess what they're saying before they finish. Some patients are annoyed by this. My viewpoint is that the more you figure out what I'm trying to say, the less I have to type. I've been breathed on, coughed on, sneezed on, and spit on. It's amazing how many mouth breathers I have on my side of the family. I hate being breathed on. Don't hover over a patient and breathe on them, especially during the cold and flu season. Remember, a simple cold for you might very well be the death of me. So please wear a mask when working with a patient, if you happen to be feeling under the weather. And, finally, when administering cough assist, watch where you're pointing that thing. I don't care if my snot ball flies across the room and hits the window, just don't point it at me. Hey, that's it for me. Thank you for your time.